Broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone, and welcome to Temperature Checks and More, what you need to know about workplace health screenings. I'm Vinny Civitello, Communications Manager for the New Jersey Business and Industry Association. With us today are Marianne Tolomeo and Hurley Kellett of Connell, Foley. A few housekeeping matters before we get started. Today's webinar is being recorded and will be emailed to you tomorrow along with the PowerPoint for today's presentation, so be on the lookout for those. If you just can't wait, you can download them right now from the webinar handouts. But I'd also like to draw your attention to the questions tab. Marianne and Molly would be happy to take your questions, so get them in as they come to you. Today's webinar has been approved for 1.6 CLE credits and 1.25 SHRM. For more information on that, download the NJBIA links document in the handouts. One last thing, GoToWebinar does appear to have an active service disruption today, so if because of that or for any other reason you have audio-visual issues with the platform, you can try refreshing your browser. But if that doesn't work, don't forget you will automatically be receiving that recording within 24 hours. So if you have to sign out and watch that, you won't miss a thing. So now let's get things started. Molly?
Thank you, Vinny. And thank you to everyone for being here this morning. Marianne and I are here to talk about workplace health screenings as we all prepare to reopen during the COVID-19 pandemic. So let's get started. The first question that you might be asking is, why do we need to screen? Why should an employer screen their employees? And there are a couple of reasons for this. First is, the logical reason to prevent the spread of COVID-19 among your employees and to maintain a safe and healthy workplace environment. The next reasons are a little bit more, I guess you could say cynical, but, because government requirements mandate that you do so. And that's general requirements by the federal government, OSHA standards that require employers to maintain a safe workplace for their employees. And there are also COVID-specific requirements that have been issued by the federal government and by the state. The New Jersey requirements are fairly specific, and they do require temperature checks and screening for certain types of employers and businesses. For example, agriculture workers, restaurants and food service establishments, as well as hair salons and personal care businesses, which I believe will be reopening this week or in the next week. Those industries in particular must screen their workers. And it also helps to alleviate your employees' concerns about coming back to work. Will they be safe in their workplace? It's also good to have a screening screening in place, and a certain guidelines that you're going to follow that you provide to your employees, like a policy, so that it manages employee expectations. They're not shocked when they come to work and they have to have their temperature taken. And finally, probably, as I said, one of the most important protections for you as an employer is to limit liability. When you're doing the screenings, you are permitted to maintain your records of what employee temperatures were, or whether employees were exhibiting symptoms, if that's what you do as part of your screening, and you can maintain those logs in the event that an employee comes back and says that they contracted COVID within the workplace. When you're going to implement screenings for your employees, there are important limitations that you need to be aware of. You are permitted to do them, and as I said, in some cases required. And this is because the EOC has found that COVID-19 is presenting a direct threat to employees within the workplace. And so that takes you into a rationale under the ADA that allows medical screenings, whereas generally speaking, employers aren't able to, demand medical information or conduct medical examinations of their employees. The critical piece is the timing here. And that is, there are some limitations on who you can screen and when. For instance, if you furloughed an employee while the employee is out on furlough, you shouldn't be demanding that they go get tested, or that they come in to have their temperature taken, or that they complete a questionnaire about symptoms that they've suffered, or people within their home have suffered. You should wait until once they were returned to the office or business place, or once their return is confirmed and they have a start date to come back to work. For the rest of your workforce, when they are returning to work or in anticipation of returning to work, that's when you can start engaging in this process. And the other important thing to remember as a limitation is that it must be implemented in a non-discriminatory fashion. Your employers are still going to be subject to the ADA requirements. And if you're seen as treating certain classes of employees or certain types of employees, you know, for example, people that are over 60, only people that are over 65 are subject to the temperature healthcare screening requirements, that is not going to be an appropriate policy. You should treat all employees the same. Every employee should be subject to the same health care screening guidelines and requirements. To that end, don't use race or religion to evaluate risk. You shouldn't be, you know, identifying certain classes of employees as higher risk based on those factors. And, you know, modifying the screening guidelines according to a person's race or religion. Another important thing to do is you have to provide translators and interpreters if needed. And in that scenario, it would be if you are doing in-person screenings when the employees visit the workplace and you are taking temperatures, asking them questions about where they've been recently, whether they've suffered symptoms. In those cases, you need to make sure that you're accurately communicating with your employees and that they understand the questions that they're asking so they can provide accurate information. A good rule of thumb on this is that a written policy fosters uniform application. So in the event that there is a challenge to the policy, or there is a claim that discrimination is being, the policy is discriminatory, you have written guidelines in place and you've created a healthcare screening policy that allows you to defend against any of those challenges. And another key limitation on when you're conducting your healthcare screening is that the information is medical information of your employees. That has to be kept confidential. And there's a couple of components to that. The first is in implementing the policy, you need to make sure that you're implementing in a way that doesn't allow other employees to hear medical information of others. For example, you need to make sure that if you're asking questions, it's done in a private area. It shouldn't be done in the you know, entryway of the workplace where people are coming and going and you're having a private conversation discussing private medical information with several employees within earshot of other folks. The second key piece here is personnel. Who is conducting the screening? So the screener should be trustworthy, of course, and you should be able to trust them that they're going to maintain the confidential information, but that's not where it ends. Who's going to see this information? It really should be someone at a management level. You shouldn't have someone that is, you know, a necessarily a colleague or a lower level employee. You want someone that can be trusted to maintain confidentiality and is at the management level of the business. And that's actually a guideline from the EEOC. That's not just a tip. That is a requirement that you really have to implement. And finally, the last piece of critical, the last critical part of this confidentiality limitation is record keeping. And this, again, is part of the ADA. And you need to, in order not to run afoul of those requirements, you have to maintain an employee's medical information in a separate file. So you're not going to put logs or temperature records in personnel or regular employees file. You have to keep it separate. And if you do the logs in a way that is for each employee individually, then you can maintain them in a separate medical file for that employee, should they already have one. If you have other medical information that you're keeping, for instance, if they've requested a disability or an accommodation in some regard previously, you can put it in that file. Where it gets a little tricky is when you're logging everyone's information together, and that should be kept in a separate file. And the other thing that I think we'll talk about a little bit later is the timing of how long you're going to keep that, how long you're going to maintain that confidential medical information. So the next important thing to think about is your screening methodology. There's a couple of ways that you can conduct the healthcare screening. You could do it off-site, you could do it on-site, which we talked a little bit about and we'll get into, or you could do a hybrid of both. Off-site allows generally for voluntary self-monitoring. So in that sense, you're going to be relying on employees self-reporting symptoms, taking their own temperature perhaps, and it also, you know, in doing that and considering whether you want to do off-site screenings, you should consider the incentives, you know, for self-reporting and what type of business you have. You know, is it hourly employees? What will people want to be truthful in their reporting? Things like that. So that is a consideration that you might want to make in this determination. So what you would do is you would have your employees come to you and tell you your daily temperature, and you then, you know, based on that reporting, you would give them instructions on whether or not they can appear at work and the like. So you're also going to probably have them answer a couple of questions and, you know, what's your exposure been? Have you been around anyone with COVID-19 or that is suspected of having COVID-19, things like that. One of what is emerging as the most common way, or some employers might think the best way to conduct this self-monitoring, and that creates a uniformity across employees, is phone apps. So a lot of companies are entering this space. There's some small startups that are creating apps for this purpose, and also some large corporations. For example, PwC just came out with an app called Check-In. It has two parts to it, and the first is daily health updates from your employees, where your employees go and they input the information, and then that is sent to your employer. And also the second component of that is contact tracing, so that you have that information and all of your employees have the app to allow for contact tracing should someone test positive for COVID-19 that's been in the workplace. Another app that is available is a United Health Microsoft app that just came out, and it's called Protect Well. That app is actually, according to some of the materials available about it, is free of charge, and it does the screening in an app and then clears an employee for work that day. So that information is maintained by United Health, that healthcare information. And it also, that particular app also can provide for a streamlined testing process. So in other words, if an employee is reporting symptoms or a temperature and is flagged for needing a test, then that the Protect Well app can provide them testing information, where to go to get a test, and then once the test comes back, those test results will go directly to the employer. So that closes the loop on that process, which could be helpful in that regard. So those are a couple apps. There's a bunch of different ones out there. You know, something to remember is that this is a very new space. This is a very new endeavor. And there's not going to be a lot of information about, you know, the accuracy of the apps, whether they're probably still going to be working out some bugs. And you're going to have to create a comfort level with your employees on using the app. Some employees might be more comfortable with mobile phones and iPhones and apps and things than others. And some employees might push back a bit on sharing healthcare information about themselves with an app. So you might want to be aware of what the company that's maintaining the data is doing with that data before you engage with a vendor in that regard. So the next type of methodology is on-site, and that's going to be your more standard screenings that you're probably hearing more about. You know, you're taking everyone's temperature with a thermometer, and then you are providing a questionnaire or giving employees a list of questions about symptoms and exposure that they have to answer as a precondition to coming on site. The other thing is that you can employ a hybrid of these two methodologies. In that sense, you could, for example, use an app to have employees self-report their symptoms and exposure, and then you could bring them on site, or you could have them report to work, report to, you know, the workplace if the app clears them, or if their self-reporting suggests that they are not suffering symptoms of COVID. And then when they report to work, you could take their temperatures, and then you would maintain that in a separate log. So there's a couple of factors to consider when you are deciding on your methodology. The first is, you know, number of employees. If you have 1 employee versus 100 employees, I think this is going to be significant in, you know, determining whether you're going to invest in an app versus whether or not you're just going to take a temperature. So it also creates answers to basic questions, process questions. How many thermometers do you need, for example? How many spaces do you need to take the temperatures? Things like that. And another thing is, do you have sufficient personnel to do the screening? We're going to talk about who conducts the screening, and that's going to be a significant part of your decision on what methodology you're going to employ. Another important consideration that a lot of businesses really need to be mindful of right now is cost. Where are you going to spend or focus this cost investment? Essentially, because of the requirements and because of the, you know, the high risk of this disease that is impacting pretty much every workplace across the country, particularly here in New Jersey, you're going to have to make an investment. So where do you want to focus that investment? Do you want to invest in high-end technology or an app and, you know, provide that to all employees? Or do you want to funnel your money into covering the cost of testing for your employees? So that's a really important consideration. Again, another thing you have to think about is the nature of your work. Are you in an office versus are you in a restaurant? As we saw, restaurants have a lot of restrictions imposed on them. For instance, they are now allowed to open, but it's for outdoor dining only. In an office, you can do manual temperatures or self-reporting, and you can kind of decide what's better suited to your particular office versus a restaurant where you have kind of a one-size-fits-all requirement more as a result of the state requirements. Another thing is the space within your workplace. Can you maintain social distance requirements, which are going to be in place for the foreseeable future and will apply to these healthcare screenings that you're conducting. If you can't, then you might want to think about doing the offsite reporting and temperature checks. And then finally, and this is a big one to think about, is employee trust. Like I said, are the workers going to accurately report their information? Are your employees going to be willing to give that information up? You know, will they be taking their temperatures? Does everyone have a thermometer? Another consideration on this is, are employees going to push back against you maintaining their data and their sensitive healthcare information? A key way that you can combat this, or concerns that are created by this, is informing employees what the company is actually doing with this information. And you can do that by providing your employees with a copy of your healthcare screening policy. And that's why it's, again, really important to have a policy in place. You can tell them things like, you're going to keep the information, but for how long? And you'll delete it after, you know, for example, in New York, there's a requirement that temperature logs must be deleted within 30 days. So if that's the requirement, or if that's the policy that you're going to follow, then you should provide employees with that information. And hopefully it will increase, you know, their level of comfort with something that's new for everybody, really. So when you've selected that you're going to do on-site screening, there's some important things that you have to consider in kind of creating your policy and creating your process. So first, we discussed a little bit, is the location. Is the temperature check screening location going to be outside of the building or right at the entrance? There is a requirement in New Jersey that it's prior to entering the facility. So you want to be mindful that you don't run afoul of that requirement. It can't be, you know, within the heart of the office. You have to be as you open. Do you have, you know, a lobby where you could do it? And if you have a high volume of employees, particularly arriving at the same time, you might need to set up multiple stations or multiple sites, one in the front entrance, one in the back entrance. Another thing in that, if you are going to have a high volume, you need to stagger arrival times. And so we talked about confidentiality implications earlier. You have to ensure that the screenings are done in a private environment. It has to be as private as possible. So can other people hear? If so, you might want to go back to that app again. And how are the results recorded? Are you writing them down? Can people see them? Where is the screener physically? Do you have a physical barrier? Is there a curtain or a door? Is it almost like you're walking into a, you know, what you would view as a little medical screening? Do you have shower curtains surrounding them? You know, the other thing is there a physical barrier, an actual plexiglass? We've seen them come up in our grocery stores and Walgreens and CVS. Do you need to put that down in front of your front desk so that someone can conduct the screenings there? And in that sense, you're going to have it in your lobby and at your front door, most likely, but that's because everyone that's going to come in most likely has to be screened. And you'll address this in your policy, but you know, it's not just screening employees, visitors. Any visitors that are coming to the workplace should probably be screened as well. So the final consideration in creating your on-site screening process is to ensure safety. And that's stuff that we're hearing for what we're doing when we go everywhere. You're going to maintain social distancing. You have to wear a face covering. That's the person being screened as well as the screener. Hand sanitize before and after screening. You know, wipe down your temperature, your thermometer between every check, and whether there's a barrier between the screener and the employee. So for on-site screeners, this is a bit of a trick. It's an important thing to consider. You don't have to use medical personnel, but you might want to consider it. You know, if you're using a third party, a nurse to come in, or you've employed a healthcare consultant, that might be helpful. If you are using someone from within the company, they are going to need to be trained on this. You don't want them to just show up and start taking temperatures. That would be not consistent with what the state requirements are. So like I said, you want to use management personnel if possible, because that screener is going to obtain confidential medical information regarding your employees. And you need to train them. They need to understand how to use the thermometer and any other equipment that they might be using, how to respond to employee answers. And Marianne's going to get into this. There needs to be a set policy on how we treat folks that are reporting symptoms, how we treat folks that have tested positive, how we treat folks that are waiting for test results, things like that. And sanitation, cleaning is very important that you maintain those practices, as well as wearing the appropriate PPE. So the next thing that we're going to get into is types of medical screening. But I think before we start, I will give you your first CLE code, and that is JU607. And so there are three primary methods. The first we've talked about a lot is just a temperature check. The second is symptom screens, and the third is exposure screens. So the first method is just the temperature check, and there are several different ways you could do it. And the criteria is, generally speaking, according to health guidelines that have been issued in the CDC. If it's higher than 100.4 degrees and they're reporting feeling feverish, then that's probably going to be a flag that there is potential that they could be infected with COVID-19. Now, important thing to remember about using just temperature checks is that a high temperature is not dispositive of infection with COVID-19. Someone can be infected and not have a temperature, and someone can have a temperature and not be infected. So the other thing is, this technically qualifies as a medical examination under the ADA, but employers are permitted to do this because of the direct threat and risk created by COVID to employees. The second way to do it is the symptom screening, and you can do this in a few different ways. You could do just a visual inspection, and you would, see, are they coughing? Do they appear to have shortness of breath, flushed cheeks? And then you would, ask them about their COVID, whether or not they're suffering from COVID symptoms, excuse me. So an important thing to remember here is that these are the current known symptoms of the disease, but this is an evolving type of disease, and there is not a lot of information even still known about it. So as you can see, the nausea, vomiting, and diarrhea, that was not always included. That was added I think in April, when it became clear that that was actually an early onset sign. So this list could expand. But the key is to rely on the data or the guidelines that are coming out of the CDC or the New Jersey state guidelines, or a reputable medical source. And then you would have your symptom screening. And in that case, you would have a questionnaire, and you would ask generally 4 questions. If anyone's gone to a medical provider recently or visited a hospital, this is what you're asked before you're allowed to come into most doctor's offices right now. And so for both the symptom and the exposure questionnaires, you're going to use the worker's language. If you have employees that speak several languages, then you want a written questionnaire, and all of these, everyone to provide to everyone. And you not only want to ask questions, but you want to have proof that they read the questions, answered the questions, and provided, you with your responses. So you would have them sign. There would be evidence through, they submitted the information through an app, things like that. So Marianne is going to take over on the exposure screening.
Good morning, everybody. In terms of talking about exposure screening, there's really two concepts that are very important that employers understand. One is the concept of close contact. The CDC has defined that as being less than 6 feet for a prolonged period of time. Prolonged period of time is defined as more than 15 minutes. This is an example of a criteria that has changed as the COVID-19 pandemic developed. Originally, the CDC said 10 minutes. Recently, they've changed it to 15 minutes as their information and as their knowledge increases. The same is true with respect to hard surfaces. I think some of you may have seen that the CDC is now saying in its advice that they do not think it's a primary way COVID-19 spreads, picking things up from surfaces, and that's more difficult. They're really focusing now on the droplets, and that's why they're encouraging face coverings, etc. So close contact is being within 6 feet for a prolonged period of time without adequate PPE, that's personal protective equipment, to a person with COVID-19 during their contagious period. I want to point out that personal protective equipment is not technically a face covering. Unless it's an N95 mask or something that's been approved as personal protective equipment, a face covering is not considered that. So if you're in a work environment or somebody's home and they're within 6 feet and they're wearing a face mask, that is not sufficient to take away the close contact. Contagious period. Again, this is a key concept when you're talking about exposure. And you're talking about the period during which somebody who has the disease or develops it could pass it on to other people. According to the CDC guidelines, people are thought to be contagious from 2 days before the symptoms develop to 14 days after onset. I'm sorry, if there's once somebody is exposed, they can still get it for 14 days. What is recovery? Recovery is defined by the CDC based on 3 factors. 1, 72 hours since you've had a fever without fever-reducing drugs. If somebody doesn't have a fever, obviously that criteria doesn't apply. 72 hours in improvement in respiratory symptoms. That's coughing, sneezing, etc. And finally, 10 days after the onset of symptoms. So you have to meet all 3 criteria in order to be recovered by the CDC. This is another example where the guidance has changed. It used to be 7 days from the onset of symptoms, and then in early May, the CDC changed it to at least 10 days because they found that people were contagious longer than they originally thought. The other thing is people can test positive for coronavirus and COVID-19 without actually being contagious. So we're going to talk about lab tests later on, but it's one of the things you might want to keep in mind. What are the exposure points to people having, quote, recent exposure? Household members, obviously, family, close friends, work, travel. As states open up, you're going to have more exposure points because people are seeing more people, they're doing more, and they frankly are not going to always know when someone they've been in close contact with that later develops COVID. So it's a little trickier now that the states are opening up. Okay. What are some of the questions you want to ask about exposure? Again, you're asking this not just because someone has symptoms, it's because they may have been exposed to somebody and they could be in their infectious period themselves. It could be within the 2 days before they're going to develop symptoms. So this is what these questions are geared towards. One is, are any household members or person you've been in close contact with currently waiting for COVID-19 results? Presumably, if they were tested for COVID-19, there were some symptoms there. Have any household members or persons in close contact recently tested positive for COVID-19? Again, you're asking within 14 days because that's according to the CDC, the maximum period for someone who's been exposed to develop the disease. Next question, have any household members or persons in close contacts recently, within the past 14 days, experienced or manifested any COVID-19 symptoms? And are you caring for anyone who is ill? The last question is an open question, and that might elicit from people, why are you caring for this person? Do they have a fever? Do they have a cough, etc.? So by asking these questions, you're trying to drill down on whether the person has been exposed or potentially exposed to somebody with COVID-19. The next area, we have to change the slide. The next area is travel. That can be an exposure point. And this was really, at the beginning of the pandemic, something that employers were quite concerned about. We get some questions about what employers can and cannot do with respect to travel. They basically cannot restrict personal travel. An employer cannot say you can't travel out of the country. At early points of the pandemic, you can't go to Italy, you can't go to China. They can't do that. Employers can restrict business travel, and many are doing that. They're saying unless it's absolutely necessary, there's going to be no business travel. People can teleconference, they can use Zoom, etc. We're going to minimize the exposure to potential COVID-19 cases. But if someone does engage, say, in personal travel, the employer has the right then to restrict their access to the workplace. So if you ask an employee, have you recently traveled outside the country, regional area or country, you'll get information as to whether they have traveled to another country that you might then want to say, okay, for 14 days you have to quarantine at home. We're not going to have you in the workplace. Now, you may allow them to telework. A lot of people have been doing that, but you would be within your rights to say you can't come in for 14 days. You have to quarantine. We encourage employers to retain the discretion to also instruct people to self-quarantine if they have traveled to other regions that might be hotspots. This is, as everybody knows, a developing situation, and hotspots develop. We've been hearing a lot about Arizona. We've been hearing about Florida. We've been hearing about North Carolina. These are regional hotspots, and when an employee gives a response that they've been to one of those places, the employer may want to require that they quarantine at home if they've been someplace that has developed into a hotspot. Lab tests. At certain points, people thought that lab tests were really going to be the answer. For example, when the information first came out about antigen testing, there was a lot of interest in using that as the criteria for letting people come back to work. In other words, people who had the antigens were quote unquote safe and they could come back. Well, it's turned out that there are a couple problems with that. First of all, antigen tests are not entirely reliable. They're getting better, and you'd really want to look to see whether the FDA has approved an antigen test before relying on it. Second, it's unclear now whether people who have the antigens are totally immune or the lump of immunity. So it's turned out not to be the free pass that people were hoping for early on. Now that may change as we keep saying things are developing. In addition to antigen testing, there's actual testing for COVID-19. So first big picture item is if there are no tests available, you can't really require a test because then people can't get them, and you're perhaps unnecessarily blocking access to the workplace. There's really two situations where employers should encourage tests in our view. First is if employees have symptoms, and second is if they have been exposed to COVID-19. The first group is really the most important because you want to get people back to work. So if somebody during a health screening comes in and they have a fever and they have a cough, the employer is going to say, you need to go home. You can't come into the workplace. Now, normally, unless you had a test, you'd have to say, and you have to quarantine for 14 days because that's the exposure period, or that's the, you have to quarantine until recovery. But if you have a test, if you have access to a test, that employee can be sent for testing that day or the next day and will have the results within a period of time. They're getting quicker. Sometimes it's a day or two. It used to be up to a week, but that's considerably shorter than 10 days, 14 days, 20 days, whatever it might otherwise be. So that's a really important time to encourage employees to get tests if they have symptoms. Employees who are exposed to COVID-19, That's another reason why they might want to get tested. Unfortunately, when you're talking about exposure, because you can develop it up to 14 days afterwards, the employee could have been exposed to somebody 3 days earlier. They could get the test, a day after they came to work and you sent them home, and they don't develop it for another 10 days. So then the test has given sort of a false sense of security. So you have to be careful in relying on tests as the answer. On the other hand, if somebody has, we're going to get to what happens when you actually test positive or negative. So I'll skip that for now. What about the cost of testing? As many people may be aware, in New Jersey anyway, there's been an executive order that says that the insurance companies have to pay for medically necessary tests. So if your employees have health insurance, it should be covering it. If they don't have health insurance or the insurance company doesn't pay for it and the employer is requiring the test, then yes, the employer should pay for it. If an employee just decides, for example, that they want to go out and get antigen testing, not because anybody asked them to, because they just, quote, want to know, then that is not something that the employer is required to pay for. In terms of cost, the other issue that might come up is what about the time spent in line waiting to get medically screened, any of that delay? That is a period that employers should pay their employees for because it's necessary to come into the workplace. So it also gives employers an incentive to have an efficient medical screening policy or protocol, in fact. Okay. So now you've done the screening. What happens next? Well, obviously, if it's negative, the employee can enter the workplace. In some, I've looked at a lot of employee screening protocols in the last month or so, and one of the things that employers are doing is they're designating which people have been cleared for entry. So, like similar to going to a party when you were younger, or entering an amusement park, some employers are using color-coded wristlets. So once somebody is cleared, they get the wristlet and they can go in and out of the workplace that day. And they would use different ones every day, sort of like a beach pass. When people use handheld apps, often what will happen is they'll get an email that gives a big green light, and that means you can go in, or a scan that means you can go in. It's depending on the size of the workplace, you may or may not need to do something like that to make it clear that certain people have passed and can go in. If positive, what happens when somebody, as I said, has the symptoms of COVID-19? What do you do? The CDC has been very clear that when people have symptoms of COVID-19, you should not let them into the workplace because they're concerned about exposing other people. Second thing you should consider what about safe transport? You've now told somebody to go home. Presumably, if they got there on their own and were well enough to drive or take public transportation, they should be able to get home. But somebody might develop sickness during the day, and employers should think about how they're going to get home. Are they going to, call for a car transport? Is there a van that they can sit, 6 feet back? Whatever it is, it's something to consider. Contact tracing for coworkers. Again, we're going to go back to the concept of close contact. If an employee tests positive, they call in, they tested positive, or you're sending them home, you want to ask them about who you've had close contact with in the workplace. Some workplaces are very small, and you know who works with whom. It's one office, everybody's in close contact, or it's 15 floors in a building. So somebody on the 15th floor doesn't need to know or to be quizzed if somebody on the 10th floor tested positive or has the symptoms. But when you ask employees before they leave, if you can, who have you been in close contact with, you really want to focus on the 6 feet prolonged period of time. So, people are passing in the hall. If they just happen to be using the Xerox machine after you, something like that, that's not considered close contact. Cleaning the work site. Employers get very hyper about cleaning the workplace. As I mentioned before, the CDC has now said that they don't think that this is the primary way that COVID-19 passes from one person to another from surfaces. They're still obviously encouraging constant cleaning, hygiene practices, etc. So what do you do if somebody, say, works in their own office and develops COVID-19? Well, first thing, you don't rush in to clean it as soon as they leave. You still want to give it some time. And the CDC is recommending 24 hours. Open the windows, doors if you can, and let the place clear out, freshen it. After 24 hours, you should clean it. If you can't wait 24 hours, wait as long as you can and then clean it. If the employee has not been in the office for 7 days and they're just calling in and saying, I have it, there's no need for extra cleaning or special cleaning. According to the CDC, the risk is gone at that point after 7 days. Okay. If someone is positive and you instruct them to leave, you really should have, as a best practice, information ready for them. Who should they call? Should they call somebody from HR? Should they call their supervisor to get more instructions about what they should do? And when they call the person, either you give it into them in paper when they leave, or when they call the person, that person should have information on, are they going to be able to telework? What are the leave policies? Is there any way for the employee to get paid? Lots of questions that an employee is going to have. And the employer should try, before instituting this, to come up with some of those answers based on broad categories. And they may have to supplement them as time goes on. But employees obviously want answers, and you want to be in a position to give them to them. Now, so employees who have a confirmed case of COVID-19, first of all, cannot work on site until recovery. That's a guideline by pretty much every health authority, state government, federal government, etc. There, as I indicated before, there are criteria for recovery. The CDC says this is how you determine that someone is quote unquote recovered. They have to have at least 3 full days, 72 hours of being fever-free without the help of fever-reducing drugs. That's 1. 2, they need to have at least 3 full days, 72 hours. Time has passed since improvement in respiratory symptoms. Why respiratory symptoms? Because that's how the CDC thinks that the disease primarily infects other people, is through coughing and sneezing. So if someone doesn't have respiratory symptoms, they're not going to be putting these droplets into the air. And then finally, the third criteria is at least 10 days have passed since the onset of symptoms. These are all 3 of these prongs must be met. You can't just say, okay, it's been 10 days since symptoms started, but I still have a fever, so I can go back to work. No, you need all 3 to be met. Now, some people are asymptomatic. So when they're asymptomatic, you can't really rely on the 72 hours of symptom-free in order to go back to work. So what the CDC says with people who are asymptomatic is that you wait 10 days from the test. Okay, so there's this 10-day period that the CDC is using as a bright line rule with respect to asymptomatic people. That means, however, if somebody develops symptoms, then you have to do the symptom prongs of it as well. Okay, state and local regulations and recommendations can differ. This is for all recovery. For example, at one point when I looked at the New Jersey standards, they simply said improvement in symptoms. And it was more than the respiratory symptoms. It was improvement in symptoms. So that's something that you want to consider, what the state is saying. Right now, however, the CDC criteria has really been the overarching criteria for recovery in the country. Employers can also impose their own requirements. An employer can say, you need a health provider note saying that you're cleared to come back to work. The CDC does not recommend this because people may be too busy for the provider to actually give the notes. People may not be able to get in to get appointments, etc. This might be more helpful if someone actually never had it. For example, somebody, has symptoms, but they test negative, and the health provider feels that it's due to another condition. That might be something where an employee could get a note saying, you know what, I'm coughing, but I've been to the doctor, I've been to the nurse practitioner, I've had the test, and here's a note saying that I'm actually cleared for work. The employer can say, we don't want 10 days, we want 12 days of symptom-free. We want 14 days of symptom-free. Employer can decide that, but it has to be based on objective medical evidence. An employer just couldn't say somebody has to be out for 30 days after they test positive. That would not, be objective, based on objective medical evidence if they were symptom-free, et cetera, for, 20 of those days. A negative test result, employers can require that. However, the health authorities are finding that people are testing positive for longer than the period that they are contagious. So some people may test positive for 30 days, and it's only that they're shedding remnants of it. It does not mean that they're contagious. So, negative test result can be a tough thing for an employer to require, especially since tests are difficult to get. In addition, the CDC guidelines that measure recovery by negative test results says you need 2 separate negative test results in order to be considered recovered. So most employers and most companies are using the symptom-based recovery, which is the 3 days symptom-free, 3 days improvement in respiratory, and 10 days since the onset of symptoms. Now, I mentioned inquiring about close contacts before they leave. We went over several times what close contact is, but in the work environment, it can include eating together. You can provide notice to other employees. You should not use the person who has tested positive or has been exposed. You should not reveal the name. If you think that is necessary, you can approach the person who has COVID-19 and ask if you can use the name. But in that case, you'd have to get a waiver. We would recommend that you get a waiver so that the person releases any types of claims regarding violation of medical privacy. And do the next slide. Okay, cases of suspected COVID-19 are treated pretty much the same. If they're negative, though, if they have a test, again, if they have the symptoms, they have a test and it's negative, then it's okay to, the employer has to make a decision, but it would be medically reasonable to permit them back to work because, again, if they were showing the symptoms and that was the criteria that you sent them home on, if they have the test and it comes out negative, then they don't have it based on those symptoms. Now, they could develop it later, but that's something that you could probably rely on. If the tests are positive, they have to stay home until they meet the recovery criteria. And then, again, ask about close contact within the past 14 days. And, again, the 14 days is because, people could take up to 14 days to develop it. Although these people may not have been, usually it's 2 days, for example, prior to the symptoms appearing, that somebody would be contagious. With respect to household members, the CDC does recommend that they, if you've been in close contact, for example, your spouse or your child or your in-law, somebody you're living with that you've been in close contact with has COVID, CDC recommends that you quarantine for 14 days since the last exposure. Now, that could mean that somebody who's been exposed has a longer quarantine period than someone who actually tests positive because they could be exposed in, say, day 6 of somebody's disease, and then if you add 14 days, that's 20 days. So it becomes, a very long period when it's exposure. Next slide. Special issues, refusals. What about if an employee says, I don't want you to take my temperature, you can't take it? The employer can absolutely deny entry, as Molly went over several times. The EEOC is permitting these exams and the temperatures due to a direct threat. You have a right, you have an obligation to protect your workforce. So if someone says, I'm not going to do it, then you can actually tell them they can't come in, and you can take disciplinary action. Also, you can discipline for false responses. People, if they lie about their symptoms and it turns out that they, actually had COVID-19 and they had the symptoms, if they're giving false information, that is something that discipline can be imposed for. Record keeping. Any of the temperature tests, etc., are considered a medical record, and under the ADA, they have to be kept separately from other records. But how long do you keep them? This is it's an open question at this point. As Molly said, for example, in New York, the regulations are requiring that employers not keep the records after 30 days. In New Jersey, there's been no special guidance as far as I'm aware, but there are general, regulations that govern, how long you keep, say, ADA records. You keep them for a year past when the test was given or when the employee is no longer there, whatever's later. In New Jersey, you're going to keep your your personnel records for 2 years after somebody leaves. So presumably you would keep these medical records. The big question is whether the OSHA requirements are going to apply, and there's no clear guidance on that. OSHA requires you to keep records of exposure to toxic agents in the workplace and harmful physical agents. Query whether the coronavirus is one of these agents. The problem is, if the OSHA requirements apply, and because people have gotten COVID-19 in the workplace, the requirement is to keep the records for 30 years after the employee is terminated, which is obviously a pretty big burden. So we're going to be looking for guidance on that. OSHA has issued some guidance, but it hasn't yet said, okay, you have to, you have to keep them for 30 years or not. In an abundance of caution, I guess we would have to say until that's decided, you should hold on to these records unless you're in New York State. Medical clearance documentation is permitted, but the CDC discourages. I already mentioned that earlier. Another issue, a special issue that might come up, is reasonable accommodation. In terms of medical screening, there might be a need for a reasonable accommodation. For example, if you have a deaf employee or someone who's hard of hearing and they need to lip read, you might need a mask. The person doing the screening might need a mask that has a clear window so that they can lip read. The face coverings in general, this is not a medical screening, but if somebody has difficulty breathing, they should not be required to wear a mask, face covering. If someone cannot remove it by themselves, they should not be required to use a face covering. Other types of accommodation might be different ways of doing a medical screening if someone's in a wheelchair. Pregnant employees, they cannot be, for example, barred from the workplace just because they're pregnant. They have to be treated as other people. You might want to offer them an accommodation of teleworking. They can request an accommodation, but you cannot automatically say that a pregnant employee or an employee with diabetes or something like that cannot be in the workplace. You have to go through the normal ADA standards in order to determine whether there's a direct threat to themselves, actually, by coming into the workplace. Religious exemptions, the EEOC guidelines do not address this. Because they're using a direct threat analysis, however, the religious exemptions really will probably depend on how onerous they are. So, for example, if someone says, you can't take my temperature because of some religious reason, contact between, I don't know, male, female, whatever it is, there's different ways to deal with it. Somebody can take their own temperature and show it to the person. Or if because of religious garb, it's hard to do something. If there's an easy, de minimis thing that can be done to accommodate a religious objection to health screening, we would encourage you to do it. If it's onerous and it is not gonna, if it's onerous, then the employer would have to make a decision as to whether they're gonna grant it or not. Okay. And that's it. We're on to the question and answers.
Thank you, Marianne. We've had a number of questions that came through, so I want to jump right into them. And the one that came through the most, actually from Molly, if you could just repeat the names of the apps that you were recommending, especially the free ones.
Sure. This is a common question in these presentations. There were two that I mentioned. The first is by United Health and Microsoft, and that's called Protect Well. And I think there's some information that was just released about that recently. The second is created by PwC, PricewaterhouseCoopers, and that was called Check-In. There's also other technologies that are available. Another thing that I saw while I was researching for the presentation is something called Pop ID, and that was installed at least in a couple cases in restaurants where it's a small box that you affix to the wall, and it can do thermal scanning, and then it retains the temperature. It says, okay, you're cleared to work. That's been installed in restaurants, for example. So there's a lot of different apps and technology that's available. And we've not used any of these apps, so I don't want it to sound like we're endorsing any one over another. But it's important that we, include that disclaimer. But I think doing your research and seeing what's available is important. And also a lot of the phone companies, I know that Verizon is employing contact tracing technology and things like that is important to look into as well. That you should be using hand in hand, so you have that available should someone be exposed or become infected, and you have knowledge of that.
Right. The only thing I would add is that some of the business organizations, for example, the chambers of commerce, et cetera, have created lists of vendors that are, willing and have, equipment, services, et cetera, that could be helpful for employers, and that's something that you might want to check as well.
So the second most question that came through regarded the actual recording of the temperatures. So are you keeping sort of like a pass-fail record, or are you keeping like Marianne's temperature was 98.6 on Thursday, it was 99.4 on Friday, kind of a deal?
I don't think there's a requirement that you maintain the actual number, but so you could do pass fail, and there's something to be said, I guess, for maintaining less information than more. But you can do it either way. I don't think that there's a mandate on numbers versus, and speaking to Marianne's point earlier about some of the apps just show you a green light, this person can enter. That's not giving you the actual number, but you just know that it was below 100.4.
Right. People are doing it both ways. And one of the things I wanted to put into slides, but I couldn't technologically figure out how to do it, were some examples of the screening forms. And so, for example, the state of Colorado had a lot of stuff on the website, and they had screening forms. And I think they did that in a yes, no. It was the questions, and, the question was fever over 100.4, yes, no. I just want to add one thing. The reason why people ask if one of the questions are you feeling feverish? Is that it turns out that temperature is individually determined. So although 100.4 has been, put out there as like a real fever, some people run low fever. So their normal fever is a 97. So when they get 2 points above or 3 points above at 100, they might really feel feverish and have technically a fever, but it wouldn't show up as 100.4. So again, that's why you're asking, several questions about fever.
Marianne, you touched on this next one a little bit before, but as to non-discrimination, if we have an employee who cohabits with someone who works in the healthcare industry, can our employee be considered higher risk and therefore subject to more careful screening?
I don't think it's a discrimination issue because the person is where they work, but I don't think it can paint in such broad strokes as that. So for example, somebody can work with somebody who's in the healthcare industry, but that person who works in the healthcare industry might come home and get changed in the garage and take showers and keep 6 feet distance from them. I mean, a lot of people in their homes have set up clear zones, et cetera. So I think that to paint in a really broad stroke like that would be, perhaps not the best practice. On the other hand, it's not a protected category, I don't think, working in the health industry. So it wouldn't be subject to heightened scrutiny if somebody said, because you work with a physician or somebody who works in the ICU, we want you to take COVID tests every 3 days or something like that, because working in a healthcare profession is not a suspect classification or a protected classification under the law against discrimination. I don't know if you have any thoughts on that, Molly.
No, I agree. All the guidance that has been issued is that it should be a uniform policy across the board. I would think that if you do have someone that is in that class, or not class, but who is living under those circumstances, that you would employ a policy across the board that it would capture that type of information. I think that As far as the EOC is concerned and all other guidance, the instruction is not to modify the policy to apply more stringent screening requirements to certain people within your workforce. I think you want to stay away from that. Would you agree, Marianne?
I do. I think that what Molly is pointing out, and it's a good point, is that if you're going to do something like that, make it a policy. Say anybody who cohabits with a healthcare worker, these are the procedures that we're going to follow, so that it's objective and people know they're not being singled out. So that when somebody works, say, with an Asian or lives with an Asian healthcare worker, they don't feel like they've been singled out because their partner or whatever is Asian. I mean, we talk about, the Asian group just because that's what the EEOC is using sort of as an example of potential targets of discrimination.
Our next question is, if we're implementing these new policies, do we have to add them to our current handbook, or do we create a temporary handbook for COVID-19 policies?
I don't know that it matters so much as long as you create the policies. If you're going to put them in your handbook, put them where they appropriately belong. But this might, it's a pandemic. These are pandemic policies. So, for instance, when the CDC or the EOC started dealing with COVID-19, they pointed people towards the pandemic guidance from the SARS pandemic. So I don't think it matters so much if you do it as an offset of your handbook or you incorporate it. The more important thing is to get the policies in place and distribute them so people know what they are.
I'm going to try to combine a few of the questions that I've gotten here. We work with volunteers, we work with interns, we work with temporary employees. Can we test these employees and volunteers and interns before allowing them to participate, work, etc.?
The answer is yes. In fact, because it's a threat analysis. So just because someone's an intern or a volunteer doesn't mean that they're less likely to have been exposed or to have symptoms. And so you're trying to protect your workforce, also customers. I mean, in New Jersey, the regulations are not just applied to some employees. For example, for hair salons and for personal care, the regulations when these open in 2 weeks or a week is going to require temperature taking of the customers. So yes, you certainly, anybody who's going to come into your workplace, you can in fact subject them to screening.
So for this question, some employees are saying they do not own a thermometer. Since I am requiring a daily temperature check at home before they come to work, is it a requirement that I buy it for them?
I would say if you could get them. I mean, I understand there's short supply, but
I think that's a tricky one. I mean, you need them to be, you might want to have one at the office so that if they weren't able to take one at home, then they can report it when they report to work. But that's going to be, that's a tough question.
it is. I mean, I can tell you that just in general, with respect to equipment, it is a fascinating question because, when you have people teleworking, technically, although it's a best practice to buy the equipment or the supplies that people need, the wage and hour laws don't require you to do it unless the employee buying the stuff will bring their income or their compensation below the minimum wage. So, if you could get thermometers that were $5 a piece or $10 a piece, it wouldn't be a burden for the employee, but it's much easier for the employer to pay for them. If there's a shortage of thermometers and the only thermometers that are available are $75 or $100, then I think you have a more difficult situation. And as Molly said, it might be easier to just give them the option of having them taken on site.
So earlier you touched on the recommendation that you have somebody high up in the company who can be trusted not to give out this kind of information doing the checks themselves. This person says they were planning on having a security guard take the employee's temperature and report the results to HR in their entrance. They say this is an open area. Is this a bad idea?
I think that the EEOC has instructed that it be someone that is in a management level role, or that you would trust to maintain confidentiality of medical records and medical information. If someone is seeking a disability accommodation, you are not providing that information to your security guard. So in theory, I understand that is kind of the most efficient way to do it, right? And that's probably what the idea behind using that process was. But I think that in order not to run afoul of the ADA and what the EOC has said, that you might want to consider putting someone in a more senior level role in charge of that function, or hiring a third-party medical provider personnel.
Right. Or using an app. I mean, the app,
right.
That's one benefit to using an app, is that you don't have to designate somebody and pull from management in order to do screening.
Here's kind of a two-parter. What kind of questions are asked on the apps, and what happens if people answer them untruthfully?
Well, I think that the questions are probably similar to what we discussed on the screening questionnaire. So you're not going to have, they don't have some secret sauce in the apps that are, different questions to ask about exposure or whether or not you might be exhibiting symptoms, but it's ease of implementation, ease of process, and that's what the benefits of using the apps are. And what was the second part of the question, Vinny? Sorry.
It's what about dishonesty?
Oh, well, that's, yeah. Mm-hmm. So you run the risk of that.
Right. Right. And the real risk of dishonesty is caused by people wanting to work, because they feel like they can't be absent from work because they're not going to get paid. So to the extent that the employer can allay those fears and say you can telework or whatever, it's going to encourage honesty. But, I've gotten this question a few times, and there's really no way to assure, other than fevers, which is why, temperate fevers are not the end all and be all, but it's an objective criteria that employers can use that tells you whether someone is sick or not. But there's no way to guarantee.
And that's one of the most significant things that you should consider in determining your process, whether or not you are going to have your workforce self-report versus, asking the questions on site.
So you just talked about people who really want to work. Now I've got the inverse question in the next question. Can you terminate an employee who refuses to return to work because they are concerned about their personal safety of the workplace and they can't work remotely? Is there a general time frame where it becomes appropriate to terminate an employee in such a situation?
There are really two or three circumstances or issues to consider. First of all, what is the fear based on? Is it based on a medical condition? So, for example, if somebody is high risk, if they have diabetes, if they have heart disease, are they really at high risk? That's one question. Can they get a medical certification from a doctor saying that they're high risk and they can't be in the workplace? Second, it's really an accommodation issue. What is the risk at the workplace? Does this person work alone in an office? Can the person telework? There's all sorts of questions. Third, what about, so it's a question of how safe the environment is. It's a question of what are the conditions of the employee that makes going into work higher risk. And the other component is mental health component. People with some mental health issues, if someone has has been diagnosed with an anxiety disorder or obsessive compulsive disorder, and the stress of going to work makes it impossible for them to function because of a mental illness, then yes, that is something that can be accommodated as well. But again, you would need documentation related to that. But just a simple generalized fear is not enough to to sort of qualify an employee not to come back to work. It has to be based on unsafe practices in the workplace or an unsafe environment or their own mental health or physical condition.
If we are taking temperatures on site and someone has a temperature, how do you keep that confidential if you are not allowing the employee in the building?
Well, I think there's a nuance to it that you really have to. There's no way to get around. You keep the temperature confidential, so you're not running around, shouting from the rooftops that employee was at a 103, and knowing that within the policy, you inform people that just because someone isn't allowed in doesn't necessarily mean that they've tested positive or that they are confirmed positive. It might just mean that there's potential for exposure, and you aren't disclosing necessarily workforce wide that someone has been sent home. I mean, if it's a 5-person company, then you're going to have obviously everyone will know, but if it's a 500-person company, then a few folks will know. So it's not there's no restriction on people learning that someone didn't come into the office. Also, maybe they called in sick, unless you saw someone taking a temperature and then being sent out. But that highlights the importance of a private screening area.
Right. I just want to jump in with one other point, and that goes back to a prior question about dishonesty. That's one reason why, in addition to temperature taking, visual inspection or visual screening can be important, because somebody on an app can say anything they want, but if somebody is sitting across from you coughing, then you know that they're coughing. Anyway, I just wanted to add that because it occurred to me.
And you'll probably get reports of it.
That's right. Our next question is, if your company only occupies one floor of a building, do the screenings have to occur at the entrance of the building or at the entrance to your floor?
I don't think there's I think it's wherever it's easier and there's a better location and privacy option. So I would say either or in that case.
And this issue, as it gets colder out, it might be, people could set up set points outside the building, but as it gets colder, there might be need to shift where you're going to do that.
So I'm going to try to cut down this next question. They have employees that rotate in and out, and they're asking, is it okay to perform temperature checks only on employees on their first day back in the office and not continuously?
This is something we've talked about among ourselves. Go ahead, Molly. I mean, we think it should be every day.
Yeah, I think the frequency is the frequency is something that you have to decide. But if you have people coming in and out and they're spending several days, not within the workplace, then I think that in those circumstances, even more so, you should be conducting screenings each time that they return. And I mean, some places are even implementing a temperature check in the morning, a temperature check in midday, and a temperature check before folks leave in the evening. So one, when you return from work, in my view, is not sufficient.
So you touched on this one before, but I don't remember the answer exactly, so I want to make sure. Do health screenings need to be done in person, or can the employee submit an electronic form prior to coming to the office each day?
It can be either or.
Yeah. I just want to point out, though, that in New Jersey, they are requiring it, as Molly said, for a few industries, but there has not really, I don't think, been guidance on exactly what is required, whether it can be remote or not.
It's agriculture, the restaurant and food industry, and then personal care and salons. Those are the three particular.
Right. I would say, though, that if it's one thing to submit a form online, but if Governor Murphy has said that there has to be temperature checks for employees in those industries, I would err on the side of saying that the temperature checks have to be done prior to entering the physically prior to entering the work site. So to have somebody self-report from home, their temperature might not qualify or satisfy that standard.
And to the question that was earlier, those employees have reported that they don't have a thermometer, but who's to say that other folks are reporting temperatures, but they don't have a thermometer either?
Mm-hmm.
So you touched on religious exemptions before. What if an employee says they can't wear a mask for medical reasons?
That's something that should be accommodated. But, again, if it's a reasonable accommodation, then the employer has the right to ask for documentation. So otherwise you might have, 50% of the workforce claiming that they have severe asthma. You really, face coverings can be uncomfortable. But if, a medical provider documents that there is a condition that limits their use of a face covering, it absolutely should be respected. That being said, the question is whether that's a reasonable accommodation or not. Does that person work in close contact with other people, within 6 feet? Are they on an assembly line where they're working, 1 foot from another person? It might not be a reasonable accommodation to say you can't wear a mask. You really have to look at it in the context of the workplace.
Marianne, you mentioned, oh, sorry, you were going to say something?
I just wanted to say that doesn't mean you force them to wear a mask. It means that you might need to make other accommodations. Because if they have a health reason for not using it, you don't want it.
Marianne, one of those accommodations could be telework if it's or remote work feasible.
Right, and say even my assembly line example, you could put that person at the end of the line and maybe skip a place in between. If they're not going to wear a mask. There's ways to accommodate, multiple accommodations, really.
So this question came in when you were talking about refusals. Like, say I come in, I refuse to get tested, you send me home. How long should I be sent home? Is that indefinitely until I take a test, or is there a period?
If someone is going to blanket refuse to take tests, then I think that you can ultimately terminate them. I would give them a few opportunities to take it, but you're only sending them home based on their refusal. So they can come back the next day and do it. Or you can say, you know what, you went home, you wouldn't take the test, we're not paying you for today, come back Monday, whatever it is. But, up to there's no magic number, they have to refuse 3 times before you can terminate them or whatever, but you would want to be reasonable about it. I don't know if you have anything else.
This sounds like a pretty obvious one, but I'll throw it out anyway because we have time. Should the personnel taking the temperatures wear PPE?
Yes. And that's outlined. There should be, a physical barrier if possible. They should be wearing PPE, including a mask and gloves. And you want to create as much of a barrier between the folks that are having their temperatures taken and the screener, particularly when that's also your employee, when you have an obligation to protect your screener as well.
So this next question gets into disparities between different types of devices that take temperatures. Say one device is saying 100.8 and another is saying 99 when I take it at home. How do you deal with that?
I think you could err on the side of caution. If you have a device that's showing a 100.8, I don't know that you can say I rely on this 99.8 device more than this 108. I think you have an obligation to treat it as if that's a flagged temp.
Right.
We are a regional public water utility, and employees who are called out after hours for main breaks. Should they expected to have screenings before being allowed to go repair a main break? This could be nights, weekends, holidays, etc.
Well, they would be in the field, right? So they would be sometimes outdoors or entering another person's facility. So I would think that you would be, you would have policies in place where your folks are going out in the field, they have to wear masks, and that would be more of a construction public utility worker requirement versus coming into the business in the operations.
Are building owners of office spaces required to take temperatures and screenings, or is this a tenant responsibility?
Again, there's no quote-unquote requirement other than the 3 industries that we've indicated during the webinar. And I think in general, it's the tenant space coming into the space. It doesn't mean that the operator or owner of the building could not do it. They could do it. But for example, if there's a hair salon at a mall, malls aren't open yet, or in a strip mall or whatever, the landlord doesn't have the obligation. It's the person running the hair salon who has the obligation to do it. My understanding of the regulation.
And I think you also think of the regulations holistically. This is meant to keep your workforce safe, and that obligation is on employers generally versus a landlord.
Right. And the other thing to remember is that, again, it's the big, broad parameter, close contact. So if, somebody's entering a building and only going to be walking past people, it's not a high risk environment. The operators of the building, of course, are going to want to put parameters in place on elevators. They might want to put sanitizer out so that people can do that before they touch buttons, etc. But it's generally lower risk if people are just passing through a building as opposed to working there.
Yeah, I would think that obligations on landlords are more if you have a security as the front facing and the security is provided by the landlord, you need to have, a sign in so that you can do contact tracing if you get notice that one of your tenants does have somebody that it has tested positive.
Right. The security guard might use one pen and ask the person their name and write it down so you're not passing pens. Molly's absolutely right. At a security station, the landlord would want to take certain precautions.
We have employees that travel from site to site over the course of one shift. Should employees be screened at each site multiple times throughout their day?
I think the answer is if you're going to do once a day screening, you don't have to do it at every site, but I'll defer to Molly on that.
Yeah, I think I would agree with Marianne. Do you meet somewhere in the morning and then that's where you would conduct your screenings? I think it would be difficult to set up a station at every site unless those sites are, ongoing, like you are at a work site that is going to, you have a trailer where folks report to and then go out and perform their work in the field. So it depends on the circumstances, I think.
Okay, I'm going to try to squeeze in 2 more before we close. Are masks required in offices? So say like throughout the course of the day. We have cubicles with 5 to 6 feet walls.
I think that this is going to be a function of Governor Murphy's executive orders. And in most of the executive orders, my read on them is that they are requiring face coverings in most environments. It's only been in terms of essential businesses and now non-essential retail. For example, non-essential retail, they are requiring face coverings. My instinct is that anything that comes out going forward is going to require face coverings. The general directions do say face coverings.
And I think that's consistent with what's been issued, and even businesses that sometimes have operations outside, for example, construction, that has been allowed to reopen and continue operations. But one of the specific guidelines that's been implemented for folks that are performing construction work, even if it's outside in the field, you have to wear masks and practice social distancing to the extent possible. So I expect that will also apply in an indoor setting, which will be your offices.
Right. I wanted to add, though, that, within an office building, if somebody has a separate office that's, 10 by 10, the employer could certainly say that when they're within the office at their desk, they don't need to wear the face covering. It's a risk analysis. So when you're outside your space, the face covering could be required.
So last one here asks, and I'll generalize this a little bit more than the question that was asked. Do masks have to be a specific kind of thing? There are a lot of things floating around there, from plexiglass screens to cloth to those medical things. Is there a requirement on what constitutes a mask?
I think it's a face covering. So a plexiglass screen does not qualify as a mask, but a cloth mask or an N95 or a surgical mask would qualify. It's a face covering fabric that covers your nose and your face. And that's consistent with the CDC and state guidelines.
Yes. Now, the other thing that I want to add is under OSHA has issued very specific guidelines for certain industries. So in the healthcare industry, you're not just going to wear a face mask. You're going to wear what's required for that industry. But in general, it's a face covering, and it can be cloth. It can be anything if it's not specific to the industry.
Well, thank you both so much.
Thank you for having us.
All right, so that's all the time we have. So don't forget, all of you will be receiving a recording of today's webinar and the PowerPoint slides via email within the next 24 hours. Lastly, when you close out of the webinar, a survey will come up on your screen that we hope you'll fill out so we can understand how to best provide you important information in a webinar format. Our next webinar, Taking Cover in a Pandemic, Insurance to Meet Liabilities and Practices to Reduce Future Suits and Claims, will take place today at 11:30. So by all means, feel free to register for that one on our website at njbia.org/webinars. So until next time, from Marianne Tolomeo and Molly Hurley Kellett, this is Vinny Civitello thanking you for being with us this morning and wishing you a great day.
Thanks, Vinny.